logo for 50% off at local restaurants, family fun centers, and much more. The deals are limited, so don't
Yeah, I don't
delay.
think we're going to use
When you're gone, we're gone.
And also, I want you to grab the
So click
credit
on
score.
Northwest
Find the
Deals.
credit score.
Only at com.
Hi, my name is Trish Shartok, and I teach kindergarten at Vermont Stanley County. Hi, and I miss you.
Hi, we're Mr. and Mrs. Wood.
We teach in the Riverside School District.
We want to encourage everyone to stay safe and positive during this time.
We miss you all, we're thinking of all of you, and we hope you're staying respectful, responsible, and safe.
And I want you to know that your teachers miss you so much, and that we are going to get through this.
Mr. B here, myself and the rest of the staff, just want to tell you how proud we are of you. We miss you guys.
I just want to give a good shout out to my 5th grade kids, tell you how much I miss you, and I think you're amazing.
So as you're doing your schoolwork at home, please remember that hard work pays off. We miss you.
I wanted to send a shout out to my students, telling them how much I miss sitting in their class.
I miss you guys. I wish we were together, and I can't wait to see you guys. Bye.
Please stay positive.
Brought to you by STC News. Here for good.
When you see this symbol, you know you're watching television that's educational and informational. The More You Know on NBC. Today on Vet Saving Pets, Dr. Boyd operates on a special patient.
We're fixing an ACL tear in a dog, and we're doing it on my dog.
A woman named Rosie needs her canines cleaned.
Oh yeah, there's some hefty teeth in there.
And Lulu, the bulldog, comes to Dr. James with a head bump.
Her head just started going, okay, it could be something serious like seizure activity.
With over 20,000 patients each year, this is one of the busiest emergency animal hospitals. These are the specialists who devote their lives to caring for pets, no matter what it takes. These are Vets Saving Pets. A particularly precious patient is at the Veterinary Emergency Clinic today, one that's near and dear to Dr. Devin Boyd's heart.
Hi, my name is Devin Boyd. I'm a veterinary surgeon here, and I have wanted to be a vet since I was 7, and I used to cuddle with my teddy bears, sew them back together, color them with red marker on the inside.
They're presently being housed in Devin's Veterinary College.
So today I'm doing surgery on a bull mastiff. We're doing a TPLO, tibial plateau leveling osteotomy. Essentially what we're doing is we're fixing an ACL tear in a dog. We call it cranial cruciate ligament in dogs, but it's anterior cruciate in people, so ACL. It's one of the surgeries we probably do about 6 to 8 a week. But there's something special about today's surgery because we're doing it on my dog. Sergeant is a very special dog to me. He's amazing. He's helped me through
We'll do that.
the loss of
Yeah, we'll do that for you.
And he's just the most loving, happy-go-lucky dog I've ever.
Yeah. He's a cat lover.
Anyone associated?
I absolutely do, but I'm a cat lover. But I also do love dogs. But cats actually do better in apartments than dogs do.
As Dr. Boyd leaves Sarge to be prepped for anesthetic, back in the lobby, a bulldog has arrived with a possible neurological issue.
My name is Sandra, and this is Lulu.
To let the cat out to the bathroom.
Had 2 episodes where her head starts to shake. She has a sweet personality, very loving. There's not a mean bone in her body, and she's a wonderful addition to our family. The head shaking was just a very sudden onset. She has no control over it. It's very bizarre. That's why we're here today. We were referred to the neurologist.
I have a busy day on neurology today. I have 2 referrals coming in, one right after the other. First up is Lulu. Lulu has been having some head tremor or abnormal head movement activity, so we're going to have a look at her and see if we can figure out what's going on.
So can you just describe the events to me? It's happened twice, and her head just started going.
Okay. She was saying yes?
Yeah, but very exaggerated.
Okay.
Yeah.
Oh, like a big movement.
Yeah.
And it lasted about 10 to 15 minutes?
Yes, it definitely lasted that long, yeah.
And then the other episode was about 2 months ago?
2 months ago.
Okay.
Much shorter duration.
Okay. And how long did that one last?
Just a couple minutes.
Okay. So, we're just going to take her to the back and do a neurological exam, and then I'll come back in and talk to you about what we think is going on. What if always start with walking her back and forth that way. So in her neurological examination, we're gonna watch her walk. So what do you think? I think she looks normal. Yeah, she looks normal. Perfect. The way that she's replacing her feet is totally normal. And the same thing with this hopping test. So we're pushing her over, and her normal response is going to be just to hop immediately. So if she was abnormal, what she might do is leave her foot there. Lulu had a perfectly normal neurological examination, which is great. So it seems like neurologically this dog looks like it's all normal. So what's wrong with her? Well, good question. It could be something serious like a focal seizure activity, which is seizure activity coming from a small focus in the brain, which could be reflective of a more serious underlying problem like a tumor or meningitis. What I'm going to do is offer Mom an MRI just to rule out anything structural in her brain like a tumor or inflammatory disease involving the brain. Sounds good.
Back in the lobby, there's a tiny patient with a mouthful of problems.
My name's Lorenzo DeCurtis, and I brought Rosie in because she needs a dental cleaning. She's 14 years old.
Rosie's getting up there. She's an old dog, so we don't know whether her heart muscle contracts as well as it used to. And so when we're talking about anesthesia, we need her heart to be working as well as it can.
She gets cold because she's so tiny, so when it's like freezing out and I have to walk with her, she just...
Oh, it's a ghost.
Yeah. It's like, doggy bag.
She's
pretty
precious.
good for her age. Wow.
She's 14, but I tell her she only looks 7.
Oh, yeah. There's some yucky teeth in there. She has a lot of tartar on her teeth, but she also has a lot of inflammation in her gums, and I'm sure there's probably 1 or 2 deeply infected teeth.
That's
the dog version of, doing that. Oh my goodness, I've got a, sore tooth. So we should have Dr. Williams, the cardiologist, do an echocardiogram with her.
In 1914, World War I.
Well, I have my scan tool here with. Yeah, so if you got a minute, we can scan it now, and I'll write down the information. Yep.
So at any time during the next 30 minutes, whether you want 1, 2, or more, please pick up the phone. Make the call now.
Hey, here's what he had to say.